Today we're featuring Smart Body Physical Therapy. We have Laura Bunso Bittencourt who's joining us, and she is a physical therapist to tell us what makes Smart Body Physical Therapy different.
Well, it's very different from any physical therapy clinic that you've ever been to. Number one, it's one-on-one physical therapy. But in addition to that, we specialize in pelvic health, which is really unique. We have over 95 years of experience in this area of expertise between all of our staff. And that means that we're doing women's health, men's health, and things that involve the pelvis.
You know, when we talk about this, we don't often think about that. So this really is a unique type of physical therapy catering to a very specific need for so many people that can take advantage of this. When we're talking about the pelvic area, what seems to be at most what we're discussing?
Well, there are a lot of things that can go wrong, and of course we're really probably most familiar with things that can go wrong whenever you are postpartum or have given birth to a child. But the pelvis involves a lot of structures. Specifically what we address and treat are the musculoskeletal system. So the pelvic floor muscles are really the main area where we are treating. So these kinds of things can involve urinary leakage, pelvic pain, fecal incontinence, which is where you can't control your stool, your bowel movements, chronic constipation related to mechanical obstruction. For example, if I tell people it's like trying to move the furniture out of the room without the door opening, so you have to be able to not just contract and hold those pelvic floor muscles, but you also need to be able to let them go or open them up. And along that same lines, as far as not being able to let go of the muscles, a lot of women experience pelvic pain. So there's a broad spectrum, but we tell people if you hurt between here and here, we're probably the people you want to come and see first. Yeah.
I know this can give a lot of women a lot of stress, and we have some pictures of what goes through women's minds when they're unable to hold or to try to hold in their urine, and sometimes it's a real problem. Oftentimes too, once you've given birth to a child, it also makes the muscles not as strong as they were.
It's traumatizing to them. Yeah.
Preceding the pregnancy, and that's what we're seeing right now.
Yes.
And this is this is exactly what you can help women with.
Right.
So it's
Exactly.
great to know it's out there. Okay. And then of course, like, yikes, I got to get there, and I got to get there quickly.
Yes, and there are a couple different kinds of incontinence. One type is stress incontinence, which younger women are more familiar with, and that's where if you were going to go somewhere like one of these big trampoline places and jump on the trampoline, and we're a little nervous about that, didn't want to jump with your kids because you're afraid you might leak, that's stress incontinence. Urge incontinence is when you feel like you really need to go, but you can't get there in time. And then some women are lucky enough to have both, urge and stress incontinence. It's called mixed incontinence. But there are different kinds of leakage. There are different reasons to have leakage. And you really want to have someone evaluate it to make sure you're addressing it correctly.
Okay, let's talk about the biofeedback that you have and how that works, because it almost looks to me like, and I've seen some of the graphics of an EKG or something like that, but there's a way that you guys can tell. How does that work?
So, well, it's a lot like an EKG where you can see, and this is we have some really specialized equipment at our facility, which is, again, really unusual for a physical therapy facility to have some things that are this high tech. But it is a lot like an EKG. It's called a surface EMG, so we don't use any needles or anything. They're just sticky electrodes, and we have an example of them right here on the table. They stick on the outside, and it doesn't hurt. Basically, the computer gives you a visual and some auditory on whether or not you're contracting and relaxing the muscles. If you think about it, your pelvic floor, your vaginal and rectal muscles, they're the only group of muscles in your body you really can't see when you're exercising them. When I go to the gym and I work my bicep, I can see when I'm looking in the mirror what I'm doing.
Sure.
But for the pelvic floor, you have no idea, and I can instruct you on how to do it. And if you have really no connection or coordination with those muscles, you know, it's like telling someone how to swim without, and throwing them in, basically.
But it's something that can be learned at least.
Absolutely.
And the nice thing is that there is some hope. We only have about a minute left. What would you like people to know, or any kind of, you guys?
I think the main thing we take all major insurances cover this, and specifically at Smart Body Physical Therapy, they have made special arrangements to cover biofeedback for our patients at our facility. And one of the main things I want people to know is that urinary leakage is really, really common, but that does not mean it's normal. So those of you who are 30, 40, 50 years old, who are wearing pads and panty liners, come and see us so that you can address it. Yeah.
Okay. Listen, we thank you so much for coming in, Laura. Smart Body Physical Therapy. Thanks again.
Thanks for having me.